Hello, how are you today?
Doing good. How are you?
Good. My name is Sydney. I'll be your nurse today. Can you state your full name?
Caitlin Swank.
And can you state your birthday?
09/18/2002.
Perfect. So can you tell me why you're here today?
I'm here for a head assessment
Perfect. And can you tell me where you are?
in an examination room.
Perfect. So level of consciousness is intact. So before we start, do you have any questions?
I do not.
Perfect. So speech is intact, coherent, no slurring. So I'm going to go ahead and start the assessment. So I'm going to just check your skull. Head is round and firm. I'm going to check your hair. It is full, healthy, no patches of baldness, which is perfect. So now I'm going to go ahead and assess your ears. Do you have any tenderness or pain? Perfect. Ears are warm to touch and they line up with the eyes. I'm going to check your temporal pulse. Pulse is felt bilaterally. Perfect. So I'm just going to assess your face. Face is symmetrical. Eyebrows and eyelashes are present and even. Can you smile for me? And then squint your face. And then blow up your cheeks. Perfect. So face is symmetrical when doing certain facial movements. I'm just going to pull down your eyes real quick. Conjunctiva is pink and moist. Sclera is white. So I'm going to go ahead and perform some eye exams on you. So I'm going to move my finger. Just follow with your eyes and try to keep your head still. Okay. Perfect. Other side. Perfect. She was able to complete the 6 cardinal fields of vision. So next I'm going to have you do is focus on the wall right there. Just focus. And then focus on my finger. Perfect. She was able to accommodate for distance in her pupils. So now I'm just going to shine this light on the side of your eye so you can just look at my nose. Perfect. Perfect. Pupils accommodated to light bilaterally. So now I'm just going to perform a quick hearing test and tell me if you can hear my fingers. Perfect. And then do the other side.
Yep.
Perfect. She passed the finger roll test. And then I'm going to have you open your mouth and say, ah. Perfect. Mucous membrane is pink and moist. And smile for me. Teeth are intact. None are missing. So I'm just going to feel your jaw right here. Have you had any pain or abnormal popping?
Nope.
Okay. Can you open your mouth? Close it. Any pain? Perfect. There is no abnormal popping. I'm just going to palpate for your lymph nodes. No abnormal swelling. Any tenderness? Perfect. So now I'm going to assess your trachea. It is midline, symmetrical, moves slightly bilaterally. So now can you cover one nostril, breathe in, do the other one, breathe in, breathe out. Is it used to breathe out of both nostrils? Perfect. So then I'm going to assess your carotid pulse on both sides. Pulse is felt on this side. Pulse is felt on this side. So carotid pulse is felt bilaterally. So now I'm just going to check for any bruise on your carotid artery. I'm going to switch to my bell. No vascular sounds were heard. So next I'm going to move on to your chest assessment. So can you breathe in for me? Breathe out. No heaves, thrills, or lifts were detected. And then I'm going to move to your back and do chest expansion. So take a deep breath. Perfect. Chest expansion was noted. So I'm just going to go ahead and listen to your breath sounds. Perfect. Breath sound at all quadrants in the front. So now I'm going to check your breath sounds in the back. Just take deep breaths. Perfect. Good. 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 So now I'm going to have you raise your arms up and I'm going to check on your sides. Take a deep breath. Perfect. Perfect. And then one more. Perfect. So breath sounds were present and full, no labor breathing detected. So what I'm going to do now is listen to your heart sounds. I'm going to start with my diaphragm. I'm going to listen for ape to man. Perfect. Aortic. Pulmonary. Verbs point. Tricuspid. And mitral. And then I'm going to switch to my bell and listen for any bruise. Aortic. Pulmonary. Verbs point. Tricuspid. And mitral. So, heart sounds were detected in all places, no bruise or abnormal vascular sounds detected. And then what I'm going to do is I'm going to assess your apical pulse with my diaphragm, and I will do that for a full minute. So, heart sounds, heartbeat is 60 per minute. And when I was assessing your respiratory rate next, so I would assess that for a full minute, and respiratory rate was 12 breaths per minute. So next I'm going to check your arms, so just put your arms out. Arms are symmetrical, and muscle tone is warm to touch. I'm just going to check your hands, fingernails are intact, capillary refill is less than 2 seconds. Going to check skin turgor, patient is well hydrated, no tinting. There is no clubbing of the fingernail, just in case. Can you do this? Angle is good. And then can you squeeze both my hands? Strength is bilateral, perfect. So next I'm going to have you lay down and we're going to do your abdominal assessment. But before I do that, can I have your head turn? I'm going to check your joint vein distension. No distension, and then turn the other way for me. Perfect. No jugular vein distension bilaterally. So I'm just going to inspect your abdomen. No abnormal masses, prominent venous patterns. Skin is intact with brace. Have you had any pain or tenderness recently in your abdomen? Nope. Perfect. So I'm going to go ahead and osculate for bowel movements in all 4 quadrants. I'm going to start with my diaphragm. Perfect.
So you probably actually can't hear.
Perfect. Perfect. Bowel movements were detected in all 4 quadrants, so now I'm going to use my bell to check for any abnormal vascular sounds. Perfect. Bowel movements were detected in all 4 quadrants, no abnormal vascular sounds detected. So now I'm going to move on to light palpation just to make sure you haven't had any pain or tenderness. Nope. Perfect. I'm going to just do some light palpation Any tenderness? How about here?
Nope.
Here?
Nope.
And here? Perfect. So now I'm going to move on to deep palpation. Any pain? Any pain? Any pain? Any pain here? What if I lift up?
Nope.
Perfect. So abdominal assessment is good. So now I'm going to move on to the assessment of your extremities. So legs are equal in length and muscle tone. Skin is warm to touch. I'm just going to check your tibial pulse. Tibial pulse is equal bilaterally, and I'm going to check your dorsal pulse. Dorsal pedal pulse is symmetrical bilaterally and present. So then I'm just going to check your feet and skin turgor. No tinting. Fingernails are intact and healthy.
Almost stomach.
I mean, your toenails are intact and healthy, and capillary refill is less than 2 seconds. And then I'm just going to test your peripheral senses. So let me feel my finger.
Yep. Yep.
Perfect. So you can go ahead and put your feet down, and then I'm going to have you stand up for me.
Whoa.
Okay. Any dizziness?
No.
Perfect. So I'm going to have you stand with your feet together, arms to your side, and then close your eyes. Perfect. You can open. So slight swaying is noticeable, but patient stayed in upright position, but I was there just in case if they fell. So what I'm going to have you do is walk towards me just normally. Perfect. Gait is intact. And then walk towards me on your tippy toes. Perfect. Then you can walk towards me on your heels. Perfect. And then if you can do heel to toe, walk towards me. Perfect. So patient was able to perform all exercises. Gait is normal. So now what we're going to do is test movement. So we're going to do your neck first. So again, to the side, this side, back, chin to chest. Then can you do a circle? And then do the other way. Perfect. Can you put your arms out for me? Can you resist against me? Sorry. And you put your arms out and you can move like that. Perfect. Elbow movement was good. Can you get your hands in circles? Can you flex them? Put them up. Can you touch your fingers to your thumb as quick as you can? Perfect. Can you wiggle? And can you clench your fingers? Perfect. So now we're going to do your back. Can you act like you're touching your tippy toes? Perfect. Can you lean back as far as you can? Perfect. Can you put it aside? Then this side, and can you twist? Perfect. So now we're going to do your legs. Can you extend your leg? Can you bend your knee? Can you rotate your ankle? Point it, flex it. Perfect. We're going to go to your other leg. So can you raise it up, flex at the knee, move your ankle, point, flex. It's okay. Perfect. And then can you do a shallow squat for me? Perfect. So that concludes our head to toe